CCBHCs save money. I mentioned this before. It's not if, it's when we pay for care. Do we pay it on the front end with access and intervention, whether you're in crisis or in prevention? So if you look at that right side, it's really just a pretty self-explanatory cycle of how these things start to cascade in the wrong direction or the right direction if we are involved. Now, if you look on that left side of the slide, what we're really talking about with CCBHCs is that people are faced with inadequate access to care. And even with the CCBHC, we are scaling up as fast as we can. Family and Children Services has basically doubled its access over the last 4 years, and we are still growing. So there is a lot of need and demand. But if you don't have that access, then what happens is people have to go to emergency departments or they get taken to jail. So what happens is you're automatically defaulting. So you have to think, if we're building out and investing a lot in these CCBHCs, what are we preventing people from falling into that will make them feel lost like a cog in a system and will be more expensive and unnecessarily complicated levels of care? For example, I've worked with inpatient departments that if they don't have access to us, they will obviously want to err on the side of caution. And so they will be the first to tell you that they want us there to help them figure out who really needs to go to inpatient, because if they don't have the mental health experts with them, they're going to send more people to inpatient to err on the side of caution. But if they have us there, then we're able to help them sort through that. So that's just a little taste of the ways in which our embedments and our partnerships help to make sure that people land in the right level of care. It's a lot like a traffic system. So many traffic jams are not caused by how many lanes there are, but by how long you wait to get into or off to a lane. So if, as a community mental health center, by analogy, we're more like a roundabout that keep people moving and get them into the right level of care, we are truly, truly impacting the most important thing to make sure that people get access in the least complicated way possible.